Welcome to Behind the Sports Medicine Podcast. I'm the creator and host, Andrew Rizza. I'm an allied healthcare professional that has worked in the industry for over 25 years, with the majority of my practice being in the private physical therapy space and in public school athletics. My curiosity prompted me to create Behind the Sports Medicine Podcast to discuss the ever-changing landscape in the healthcare industry, focusing on sports medicine, physical therapy, athletic training, and sports science. Each week, we will discuss the barriers that healthcare professionals face and how we as individuals can collaborate to make the listeners better understand the industry for a better patient and athlete experience. Now, on to the show. This week's guest is Dr. Cameron A. Roth. Dr. Roth is a fellowship-trained orthopedic doctor specializing in hand, wrist, and upper extremity surgery, including caring for various ailments of the hand, wrist, elbow, and shoulder in patients of all ages and lifestyles. Dr. Roth completed his medical school training at Cooper Medical School of Rowan University. He then went on to complete his residency at the University of Chicago Medical Center. His fellowship training was completed at Harvard Medical School, Brigham and Women's Hospital, Boston Children's Hospital, and AO Trauma Linden Hospital in Bern, Switzerland. As an orthopedic doctor, patient care is always at the forefront of Dr. Roth's mind, and he is fully committed to working with patients and their families to decide upon the best treatment plan. His team is dedicated to providing all patients with a compassionate, thoughtful, and empathetic approach to helping them improve, whether through conservative or surgical management. Dr. Roth has contributed several peer-reviewed research articles and is an active committee member for the American Society of Surgery of the Hand, as well as a peer reviewer for the Journal of Hand Surgery. Dr. Roth also serves as a consultant to the MLB Chicago White Sox during spring training. Outside of the office, Dr. Roth has an ongoing interest in global health and delivery to underserved populations. He has spent time living in Guatemala and Costa Rica, teaching English and public health to rural indigenous populations. In his free time, Dr. Roth enjoys running, yoga, travel, cooking, and spending time with his friends and family. Second episode of Behind the Sports Medicine, and today with me is Dr. Cameron Roth from Ortho, Arizona. I think that's correct, right, Cam?
That's right, Rick. Thanks.
So a little background. Cam and I have known each other for quite a long time. I want to say it's been 15, probably
I think
even longer, 17,
yeah,
even longer, right?
20. I think it's 20.
Oh, jeez.
Yeah,
I'm getting old.
No. You look the same. You've looked the same for 20 years.
Gray hair on the goatee.
Barely.
Well, thank you for joining me today. I think one of the things we chatted kind of pre-recording here was, how long we've known each other, and then how this is not really a family production, so anything goes. But we're going to talk about how Cam had gotten into sports medicine and why he got into sports medicine, and then we're going to kind of go from there. So, Cam, again, welcome.
Thanks, Ruth. I appreciate it.
What inspired you to get into medicine? Because I think, if you look back to when you were a high school age student, when I first met you, a young football player, what are some of the things that kind of drove you to think that, hey, I want to be a doctor someday?
So I think it's twofold. As you know, my dad was a local neurosurgeon in the community for over 40 years. And he actually got me a summer job as an OR aide and an OR transporter at the local community hospital, the summers of my sophomore, junior, senior year, and then also a couple summers in college. And originally I didn't want to do it at all because who wants to clean the OR during your high school summers? But I did it, and it completely opened my world to what it was like to be a surgeon or a nurse or a scrub tech or just to work in that environment. And as a high school athlete, all you think about is teams. All you think about is working together, working for the greatest goal. And then when you go and work in the operating room, it's exactly the same. The nurses and the techs and the assistants and the doctors and the surgeons are all working together for the benefit of the patient. It was completely eye-opening. And, you roll your eyes when you're a teenager and your parents tell you to do things. And then down the road, you say, you could not have been more correct. So that was one thing. And then, as we know, our mutual friend and one of my mentors, Dr. Tom Gill, was the Weston High football team doctor. He was also the former team doctor for the New England Patriots and Boston Red Sox. And I was able to do a high school internship with him, and then spent some summers with him in his clinic in the OR, going to the Patriots, going to the Red Sox. And again, for a sports obsessed, adolescent, high school kid, college kid, that was completely eye opening. And I don't really think there was any looking back after that. So I think, mentorship was incredibly important for me. I mean, you were obviously a big mentor as well. It just because we spent so much time together in high school, and I wasn't very often injured, but your athletic training office was sort of like the center of Weston High School athletics. Everyone passed through there every day, and you're getting people back on the field, and we developed a close relationship. And then with Dr. Gill, and then there's other docs in our community who I was able to work with, and I've never looked back.
Yeah. Interesting thing that you talked about was kind of the teamwork in the OR and all the jobs you had to do over those summers, right? So I talked to therapists, being a clinical director myself of a physical therapy practice in Wellesley, which I've been there for 28 years or so.
Yeah.
I tell my staff when I ask them to do something, I'm like, I wouldn't ask you to do something if I've never done it myself. So I will go and I will shovel the front if it's snowing. I will go clean up the bathroom if the toilet's clogged. I mean, I will do anything, but just to let you know, I'm not asking you to do something I've never done before. So that sense of teamwork and that sense of camaraderie, I think, helps build a solid kind of family and structure within the organizations you're working with. Given where you've been um, in medical school, residency, fellowship, and now where you are in Arizona, how do you think that translate? Like as far as your teams, do you seem like that is, or do you see that being as powerful in all those locations, or do you find that it's different from place to place?
I think it differs in what part of your career that you're in. I think it always applies, but as a resident, as an intern and a second year resident, junior residents, you're inundated with so much that you've never done before, and you're relying on guidance and mentorship from senior residents and faculty, and you're relying on the teamwork and support of your co-residents. And then as you rise in residency to become a senior resident or a chief resident, suddenly you serve as a mentor and a guide for the junior residents and for the medical students. And it's still a team, but you have sort of changed roles. And then when you become a young attending, suddenly, people are working not for you, but, for your benefit and for your patient's benefit. So suddenly you're the leader of this team, and now you're the leader of the team in the clinic and the leader of the team in the OR. And the team's not only your medical assistants and the DME tech, but it's also the occupational and physical therapists, the athletic trainers, the scrub techs, the circulating nurses, the anesthesiologists. So everywhere you go, you sort of have to dictate your way of leadership, and that's just learned along the way. My leadership skills when I was 17 and 18 are completely different from what they are now, and they're not perfect, and they're still developing because I work with a lot of people who are more experienced than me, who have more knowledge than me, and I'm just trying to do it in the right way, where at the end of the day, the final outcome is to the benefit of the patient.
Yeah, that's great.
Yeah.
Mention, briefly there about, who's involved, and you said occupational therapy, physical therapy, and then you said athletic trainers. This month, I don't know if you knew, but it's National Athletic Training Month.
Of course I knew that.
So it's kind of a big thing. So, um, how do you utilize athletic trainers within the practice that you're in now, or do you guys utilize them? Are they in Do you have any that are in clinic with you? Do you have any that are outreach to the schools around you? Are there any working in the OR? Because I know there is an orthopedic specialty for athletic trainers they can go through, which is a myriad of didactic, activities they have to do. They have to go through sit through a board exam. So there is some of those kind of physician extender in the OR for athletic trainers. Can you speak to that? Is there any that are working with you?
So I think the majority of people we work with in the clinic are either physical therapists or occupational therapists.
Yep.
And we have therapy on site at the majority of our clinics. And in my 2 clinics, we have physical and occupational therapists that I can literally walk right across the hall and talk to them, have them come in and see the patient that they're working on, check in, discuss in real time. We do have an athletic trainer who works in one of our clinics who actually serves as the durable medical equipment tech. So she puts on casts, fits people for braces, all sorts of upper extremity braces, sarmiento-femoral shaft fractures, wrist braces, thumb spikas, etc. We do work peripherally. I do see a lot of throwing athletes in the high school and going to college to play baseball. So we work peripherally with a lot of those athletic trainers. And then now, since I've started to work with the Chicago White Sox in spring training here in Arizona, they have a whole cohort of incredibly experienced and knowledgeable physical therapists who now we're in constant contact with. And obviously that's just for the team, but some of them, there's actually one who's transitioning to come work with us at Ortho Arizona out of the White Sox system, who spent many years in the White Sox system. So I would say, if I'm thinking back to being in Dr. Gill's clinic and I feel like he probably had more athletic trainers around at the ready, whereas, and it may be a regional thing, but we don't have as many accessible face-to-face athletic trainers. It's more physical therapists and occupational therapists.
One of the things that, that can be, we talk about direct access to care. And one of the things we've been mentioning a lot is like, how do we bring that from the athletic training space to physical therapy, but then also to the doctors? So I think you can probably remember the amount of, exposure you had being an athlete at times with physicians or with me. What we tend to see is there's a lot of communication and working side by side with physicians on the sideline. So as athletic trainers, we tend to see that there's a lot of relationship building with the residents or the fellows that are working with those orthopedic groups. So that's where we gain a lot of our relationships and build our network with those physicians. One of the things we're trying to do a lot of is getting direct access for those athletes to the orthopedics that need to see them, because I feel like there's a lot of waiting in between. Some people don't have the access. They don't understand how to get the access. They call their primary care physician. Primary care says, well, you have to go get an x-ray. We'll get an x-ray. Oh, then you got to go see the orthopedics. And now you're waiting 2 or 3 weeks. And now this athlete's had 3 weeks of in between with no care outside of, hopefully their athletic trainers caring for them, or hopefully there's a physical therapy group that has direct access. In the short time that you've been in Arizona, has there been that direct connection from high school to your group, or is it more referral based? I mean, I guess the question meaning is there athletic trainers that reach directly out to you guys to get athletes in outside of outside of your professional athletes, which obviously have the easiest access to see you?
Right. No, I would ask you, what is so if someone gets injured on the football field and you run out and you evaluate them, and whether the team doctor's there or not, how does that transition? How do you get that patient or that player in to see a doctor immediately? Like, how are you doing it? So if someone gets injured in the Thanksgiving game,
Yep.
tears their ACL or something, how does that, you go out and examine them, they have a floppy knee, Lockman
Yeah.
with no endpoint, and you're like, you got an ACL, and Dr. Gill's not there. What do you do?
Yeah, I mean, I think the big thing is we try to circumvent and make it the easiest for the athlete. So we're trying to be the liaison between, the athlete, the parent, and then to the doctor. The way I've always dealt with it was direct connection to the physician that should be caring for the athlete. So we usually give them a choice where they would like to go. We would use, it could be any one of the hospitals, major hospitals in Boston, but then we link directly to those orthopedics where, again, most of the orthopedics I deal with were fellows one time or another at Mass General. And that's how I became worked with them and built that relationship. So for me, it's almost like it's a very different scenario than with a lot of athletic trainers that are trying to bridge the gap. I think there are a lot that do have that direct connection with maybe a group of physicians that they send people to. But my big thing is one, directly connect with the doctor. Try to sign up within the next day or two. Hopefully 24 hours. If it's Thanksgiving, it's kind of tough because a lot of them are at the office on Friday. So they usually will set it up on a Monday. If it's a regular work week, Monday through Friday, they're seeing them that week. If not, they're going to see them that following Monday. And even I've had some physicians stop into the training room on the weekend during the football season where if we're in there doing treatments on Saturday, they'll pop over and take a look. So I think we're very blessed in the setting that I'm in and where you grew up um, most of your life. And I think, but that isn't everywhere. So that's kind of why I asked the question is because I'm just trying to figure out how different parts of the country and different geographical locations market or work with the other sports medicine professionals in the area to help bring access to you. If someone has, say, they have has medial elbow pain and they need to come see you, they've been throwing in little league, and how does that parent get them to you, and how quick is the access? Because access is everything, and I feel like if we deal with it with physical therapy, if a patient calls to come in for therapy and the office says, hey, we don't have an appointment for a new patient for 2 weeks, they're going to look down the list and they're going to call that next group. Okay, when can I get in the fastest? So I find that there's definitely kind of low hanging fruit there if you're working with the local high schools in the area and trying to build a relationship with the athletic trainers, that you'll have that direct access to those athletes, and then build the relationships, because then you have direct access to the athletic trainer, direct access to the athlete. The athlete has direct access to physical therapy outside of athletic training. So that whole group now has a great relationship, and then you can build that, build that from there.
Yeah, no, I think you're right. First of all, we were and are in a very unique situation where you work and I grew up. And I've only been here for about 5 months, but my educated guess would be that a lot of the more established docs, whether they're in my group or not, who live here and have kids here and who do sports medicine, upper extremity, knee, whatever, may have some connection through local high schools or the high schools that their kids attend or something like that. I personally do not, but I am also relatively new, so I'm able to get patients in very quick. And I really have no sort of age limit or type of patient that I won't see. So, I'll see patients same day or next day. And so I've seen a bunch of high school pitchers for medial sided elbow pain because of this, or I've seen some female gymnasts for shoulder injuries. I've seen a bunch of female gymnasts for actually scaphoid fractures, which is pretty interesting. So they're able to get in my clinic. I do not have personal access to an athletic trainer. I think that's a great idea. And hopefully I'm able to meet some of the local athletic trainers and get involved in that. And my guess would be their connections are through sort of word of mouth or who they know. But I don't think it's as seamless as it is back home.
Well, you have some homework to do. So in a month when I come to Arizona, we can chat about it. And if you need some help, I'll be
I'll work on it. Yeah, no, I should bring the most famous athletic trainer in the United States. I'll bring you around. It'd be everyone, you can sign autographs, and we'll get everyone
I don't
to.
think the autograph's going to be worth anything, but it'll be fun to sign them.
Yeah, you can sign it. It's so funny. I was walking. I was covering the White Sox game last week, and I was like hanging out in the dugout for a couple innings, and nobody got hurt, which is good for the team, but bad for me. So,
Yeah.
so I walked back to the office, and you sort of walk on the field along the right field line, and there weren't a lot of people in the stands, but everyone sort of sits in the front because it's easy to get good seats. And I'm walking. Obviously, nobody knows who I am, but they're sort of staring at you like a zoo animal. And I don't know whether to. And people have their autograph books out, not for me,
Yeah.
but for the
Yeah.
players, and they're just sort of following you with their eyes as you go by. And I don't know whether to acknowledge them. I mean, we're literally like 3 feet away. It's very bizarre.
Yeah. I know. You
It's
just
a very
keep
bizarre
walking.
experience.
You
I
should
keep
just
my
grab a
head
kid's and
down.
just sign it.
Yeah, he rips out the page and throws it on the ground.
You could also, and plus you probably get your lifetime supply of seeds and
Unbelievable.
Joe Bubble, whatever it is, bubble gum.
I was like,
So,
what do I do here? They're just like, well, we have 6 different kinds of sunflower seeds. I was like, okay.
yeah, and double bubble, probably a gallon of double bubble sitting
Yeah,
in the
then
corner.
I just started chewing bubble gum. I was just like, is this all we do?
Now you're gonna get TMJ and you
yeah,
have to go to therapy.
yeah. I go to therapy for my TMJ. Oh my god. Yeah, I was like, I haven't had sunflower seeds in years, and I ate like half a bag. It was great.
Yeah,
Lots of
and then
fun.
you're drinking all that water because everything's salty, and you're like,
Yeah,
oh,
yeah,
this is
yeah.
not good. Yeah,
I was like, I gotta get out of
stuff
here.
stuck in your teeth. Yeah,
Yeah,
I need
yeah.
some
I know.
floss.
Oh my god. Yeah, it was weird. Anyway.
So let me ask you this: how exciting is sitting in the dugout doing nothing for 3.5 hours? I'm sure you get through some emails.
um, it's cool to be around a lot of high level athletes, and to let them have direct access to medical care, and that's exciting. And obviously, sports are exciting. This is spring training, so it's pretty low key.
Yeah,
And everyone's great. And what I didn't realize, actually, for my professional development, all the other docs there are significantly more experienced than I am, and we've got the Chicago docs there as well as the Arizona docs. So I am, it's like another fellowship.
yeah,
When
yeah,
some of the experienced Chicago or Arizona docs are examining these patients, I'm watching.
yeah,
I'm asking
yeah,
questions
yeah,
because it's great exposure for me.
yeah, yeah.
Um,
That's
yeah.
you have to do that. I mean, we talk about this all the time. We do rounds once a week with all of our staff. So I sit every Monday morning and I do rounds with everybody in the clinic. We take an hour out of their morning and we sit down and we go over patient care. And that's the time for them to say, hey, you know what, I had this difficult case. Like, what do you think? And it's trying to go over that and let them understand, like, hey, we're always developing. And I had a professor at Northeastern when I was an undergrad, Chad Starkey. He's now at he's at Ohio University, and he's the director there now of the Doctorate of Athletic Training program. But he always said to us, he said, and he was one of those professors where he was like the shock and awe guy. So he would stand up and we would talk about like the foot, and he would talk, hey, you want to know what a flat foot looks like or pes planus? He would stand up and he took his foot out of his shoe and slammed it on the desk. And he's like, that's what that is. So he would do stuff to, just, we would then remember that, right? He said to us one day, he's like, now listen, he's like, you're going to get out of school. You are entry level. Just remember that. Even if you pass your exam, you pass your national boards, you are entry level. You always have to learn. You always have to expose yourself. You always have to have the willingness to learn. And I talk about this a lot with staff and with young athletic trainers as interns that come in. You got to think of that as being like, think of when you were a kid bowling and you put the guardrails up on the bowling alley so the ball wouldn't go down the gutter.
Mm-hmm.
That's how you have to think of your education. Like, hey, when I put the guardrails down, now I'm learning. But when I put them up, now I'm in this, like, I'm like a racehorse with blinders on, and I'm only thinking of one thing. So I think that's important. And I'm glad you brought that up because I can't reiterate that enough with people that even though you are now an orthopedic surgeon and if you've been out out of your fellowship, your 55th month down in Arizona, there's still always that learning curve, right? And you're going to see stuff like I still see stuff 20 years later. I'm like, oh my God, why didn't I think of that? Like that was right in front of my face. Like I should have seen that. And then you see different ways that people end up managing that and how they evaluate it. So that was a great point that you made there. I think it can't be said enough, especially when you're dealing with in the medical field.
No
Um,
question.
um, so we talked about becoming a doctor. Did you think of anything else other than orthopedics? Were you thinking of, hey, I
No,
want to be a cardiologist,
no,
pulmonologist, neurosurgeon? You wanted to be an orthopedic.
no, no. My dad was a neurosurgeon, and my dad was relatively intense and pretty OCD. And I did
Yeah.
uh, I did a neurosurgery case when I was a third year med student, and it was the most intense, one of the most intense. They allowed me to burr a hole in the skull, do a burr hole. Um,
Must
and
have been amazing.
luckily, yeah, the thing has it was really intense. And then I was not built for that. And knowing Dr. Gill, I said, those were the heydays of Brady and Belichick. And, I was like, I want to be the team doctor for the Patriots. What's cooler than being the team doctor for the best team in the NFL,
Yeah.
And then, obviously there's, that's a little more complex, but, orthopedic sports, right? You can actually fix people, and the majority of people you take care of are motivated, active, healthy, and they've had that taken away from them, and you can change that. And I think that's very powerful. No, I don't. There was no other option,
Yeah.
honestly.
Yeah. I mean, I have to say, for me, I'm looking back at, how one, I still can't believe I got into Northeastern University, first of all. Right now, they would take my resume and probably, I don't know what they would do with it,
Throw it
my
in the trash.
application, throw it in the trash in the shredder, use it to heat the room. I don't know, light it on fire. But it was probably one of those things. I think a friend and a really close friend of mine in high school, we got together like, hey, what are we going to do? He's like, why don't we go to apply to physical therapy school? I'm like, okay, where should we look? Back then, my guidance counselor had no idea what the heck they were doing.
Yeah.
So we applied to two schools. Two schools, that was it. I applied to Northeastern and Springfield. I got into Northeastern. PT's like, we can't take you, but there's athletic training. And I'm like, what's athletic training? And when
Yeah.
they started talking about orthopedics and working with athletes, I'm like, that's where I need to be. Right. So I think it's that healing piece. I think it's always wanting to get people better. It's the unknown of what you're doing every day. Every case is different. Every case is new. You're dealing with a person. You're dealing with that physical um, and mental piece of working with that person. As you peel back the layers of the onion, you get to learn about all these individual people, and it just makes it exciting to go to work every day. Um, but I can see where that will draw you in. And with you, I think that's also, I think coming from the background you came from, dad neurosurgeon, mom's a PT, right?
That's right.
Kind of seeing
Mom
both
is a
sides of it.
PT. Yep.
And then looking at, how can I make an influence and make a change and enjoy something? I mean, I always said, I don't know, did you ever go to my career day talks at Weston?
No, I don't think so. I don't
So I
remember
had,
any of the career day talks I went to.
So I would go in and I would talk to, I don't know, 25 kids. They just wanted to get out of class for the day, so they would sign up for whatever. And they're like, "Hey, why don't we go hang out and listen to what Riz's got to say?"
Yeah, right.
And I'd always said, and I probably heard this from one of my mentors, Pete Foley. So
Oh, of
Foles
course.
very
Yeah.
well.
Yep.
So he had said to me once, I think it was probably early in my career, and he had hired me, 20 I just saw him the other day and he couldn't believe it either. It was 28 years ago, 27 years ago.
Amazing.
Um, and he said, for one, if you enjoy what you do, you're never going to work. So
True.
it's not like that waking up that Groundhog Day, right? And the other thing he said to me is like, never waste education. And one of the things he said about education was always think about it as a second job or a part-time job. So no matter how you do it, that's always going to make you become better at what you do. And I see that with us on a daily basis when we're dealing with, it goes back to us learning and what you had said being over at the White Sox and being like this young resident now, but you're not. Like, hey, I'm listening to all these great surgeons and all these people that that are better than me or have more experience than me. So
No, they're better and more experienced. There's no
I'm
question
sure
about
you're
that.
I'm sure you're pretty good too.
Working my way slowly up.
Yeah, you'll get there. That's good.
I hope.
As far as talking about healthcare, I think the big thing that we look at is what's healthcare going to look like 5, 10, 15 years down the road. I think that's one of the challenges that we all face. And I know that my first episode was with Carl Gustafson, who's, was again, another mentor of mine that owned Sports and Physical Therapy Associates. And I've learned a lot from him over the years. He was talking about how when he had got out of college, 35 years ago, the reimbursement for physical therapy was $100 a visit. He's like,
Mm-hmm.
fast forward to today, he's like, it's 120 maybe. He's like, so in 35 years, that really hasn't changed, right? No matter what your degree looks like, bachelor's, master's, doctorate of physical therapy. And he seemed to think that the insurance was now shifting more to the patient, where the patients now, instead of a $5 copay that they had 35 years ago for insurance, now it's 50, 60, 75 and above. So they're really weighing more of the expense of the insurance. So for us, we look at how many people are going to go to physical therapy. So we try to find like, where is that going for us, which is different than what you're dealing with in orthopedics. But, he seemed to say that there was 60% of the cost is going back to the patient. So people are saying, well, I can't afford that. How can I do that twice a week? How can I do that 4 times a month? Whatever it is. Are you guys seeing anything in the orthopedic space where there's anybody that comes to you and says, hey, you know what? I really can't afford coming in to see you guys. I can't afford the copay for that injection. I can't afford the medication that you're prescribing to me. And it's just interesting because I feel like there's a way for us to circumvent that, but I just don't know what that is. So I just
Well,
didn't
I
know if
think
you, only being there for 5 months, I'm sure it's just getting used to all the other stuff, but anything from your peers that you've heard or things that you're seeing that's changing?
I think twofold. I've had a lot of patients who have surgical problems. A lot of them, like fractures of necessity, that technically need surgery.
Mm-hmm.
Who will either say, "I'm not sure I can afford this," and will say, and then they'll find out and they say either I don't have insurance or I have insurance but I can't afford it, and will treat whatever it is non-operatively and deal with the consequences later.
Mm-hmm.
So, they'll have decreased function, malunion, chronic rotator cuff tear, sequelae from all of that. And then down the line, when they're more, financially solvent or whatever, sort of deal with that problem. And that's unfortunate because, financially, obviously it's a burden, but surgically and physically, it's going to be a burden moving forward.
Mm-hmm.
And that's sad. I've also had a few patients who I'll see in clinic and order advanced imaging, like an MRI or
Yeah.
an EMG, and they will ask to get the results over the phone as opposed to coming into clinic to review them in person and talk about treatment plans because they don't want to pay another copay.
Yeah, I can see
Which,
that.
yeah, which is fine. I'm happy to give patients their MRI results over the phone and talk about treatment plans, but I like to do it in person because I like to look at the MRI on the computer with them and point out exactly what's going on. And if they need an injection or we're talking about surgery, injection obviously done in person, but if we want to talk about surgery, I like to draw diagrams of what we're going to do. And it's just more intimate and personal to do it in person. Again, I'm
Mm-hmm.
happy to give people their results over the phone, but if you think, what if 100% of my patients I had to give their MRI results over the phone? So not only do I have a full clinic, but then afterwards I have to call all the patients every day or every week who need MRI results. It's not like I'm being, reimbursed for that, and of course
Right.
it's not all about the money, but I give patients my email address, and
Yeah. Yeah.
I'll have patients email me, and I'm happy that they email me, and the majority of them don't abuse it, but answering their messages takes time as well, whether we're doing that on the weekend or at night or early in the morning, and that's sort of the extracurricular, next steps you have to take, but you're stuck between a rock and a hard place sometimes.
I agree. And I like how you had just mentioned, it's not all about the money, right? But we
No.
all have done this for a long time. We have professional degrees and it's our livelihood, right? So all my business card has my cell phone and people think I'm crazy. But I'm like, I'd rather get a direct call or a text from a patient or an athlete or a parent that has a question that I can quickly intervene and tell them it's
Mm-hmm.
going to be fine till tomorrow versus
Mm-hmm.
them going to urgent care and
Mm-hmm.
wasting healthcare dollars. Because I feel like there's a lot of waste out there, right? So for me, the experience that I have, and again, not to pat myself on the back, but I feel like it gives that patient a feeling of comfort, and they feel they have a relationship with you and they rely on you. And I think that's important. Um, I saw some of your reviews quickly. I kind of looked through on your bio and I saw you have 5-star reviews, which is amazing. And we work on reviews too. I tell all our patients, if you had a great experience, make sure you review us. If you didn't, I don't want you to review us, you know?
Yeah.
Um, and I saw one gentleman's like, when I walked in the room, I thought it was Doogie Howser. And he's like, but because my doctor retired, he's like, Dr. Roth took me on and he knew
Yeah.
exactly what I needed. And it was an A+ experience. So I think that's
That's
awesome.
so
That was one
funny.
of the things that I
I
read.
did see
I was
that.
like, that's awesome.
Someone said
So
that to me, and I laughed out loud and said that to a bunch of my co-residents.
it's great.
It's so
I have
funny.
people come in and they go, Jesus Christ, you haven't changed in like 30 years. Like, what are you doing? And I'm like,
I
nothing. I go, you don't see the gray hair in my head and my goatee? Like, you know what? You look exactly the same. I
You
actually
do.
had another graduate from Weston who graduated the first year I was there. So Fran Rachopi, who's helped me with the other side of my sports medicine stuff as leadership development stuff that we're doing. He goes, I was talking to him a couple of years ago. He's like, well, how old are you? And I hadn't talked to him for a few years. And I go, well, I'm 48. And this was a couple of years ago. I just turned 50 this past year. He goes, fuck, I thought you were 50 like 25 years ago.
I know, it's crazy.
He's like, and he said, as a kid, when you're 17, 18 years old, when you look at anybody that's 3, 4, 5 years old, you think they're much older than they actually are.
It's true.
Unless you have a peer that comes in or someone that's older than you and looks at you and they say, you're only how old? So
Yeah.
I think I think you have a long way ahead of you, which is great. And I think your passion is where it needs to be for being a physician. But I think you were surrounded by enough of medicine through your life, and then what you saw when you were on the sideline. So with that, if you could, who was your biggest mentor through this process for you? Like, who did you find that? Did you have one? Did you have two? Did you have several? Like,
I
I'm
mean,
sure there's a number,
I have
but
so many. Honestly, I mean, I could name them all, but I mean, it started with you, and it started with Tom Gill, and then JP Warner in Weston, who was
mm-hmm.
just as gracious as in having me in his clinic and shadowing and being in the OR, and we're still in touch. And then, in medical school, I worked with some of the orthopedic surgeons at Cooper, Dr. Larry Miller, Dr. David Fuller. And then in residency, I mean, that's where we really built on it. So my closest mentor was Dr. Jennifer Wolf, who's a recent president of American Society for Surgery of the Hand. Megan Conti-Mica, who's actually one of my partners now at Ortho Arizona. Jeff Steppen, Leon Benson at the University of Chicago. I mean, they were tremendous. And then fellowship at the Brigham at Harvard. So Phil Blazer, George Dyer, Brandon Earp, Dafong Zhang, Don Bay,
Yeah.
Andy Bauer, Carly Billerman. I'm indebted to all these people. Neil Chen, Kyle Everland.
Yeah,
I'm really indebted to all these
yeah.
people, and I honestly wouldn't be
Yeah.
where I am today. I just emailed a few of my mentors. I have a tough fracture proximal humerus case tomorrow, and I emailed 3 or 4 people, and it's you stand on the shoulders of giants, and
Yeah.
but
Yeah, exactly.
it's also about giving back, right? So you have your mentors above you, Foley and Gustafson, and then, but you are now a mentor to athletic trainers or and all the high school kids that you take care of who are interested. Do you still have interns from the
Yeah, so I
local
have an
colleges
intern
and
right
stuff?
now that's with me. Yeah, I mean, one that's with me for the whole year. We had that kind of hold and that pause through COVID, and it was hard to get people back. But I mean, if I look mentor wise, I mean, I look at people that I work. One, Carl, like I had mentioned, Scott Waugh, he's the
Yeah.
director at MGH Sports Med, and then I look at all our orthopedic surgeons. So I feel like they're mentors to me because I saw how they worked on the sideline when they were evaluating athletes, and it made me better, right? And I think that's the key is like you said, like being in the OR, being in clinic, watching them do what they do, and kind of put that in your toolbox. Like, how did you see that work? I mean, I was talking once to we were dealing a lot with concussion rehab and concussion protocol through the years, and this is kind of was the big thing, and still is. There's still a lot that goes into it. But I remember talking to Mickey Collins, who was one of the founders of Impact Testing, and he's a neuropsychologist at University of Pittsburgh Medical Center. And him and I were talking one day. We were in a panel discussion together on head injury and concussion rehab, and he turned to me and he said, "What are you doing for rehab for these athletes?" And this was going back. I'm probably going to say it was 2012. So this is a long time ago in relationship to concussion rehab. And I said, well, if they have low level symptoms and they come into me and after we examine them, I'm going to get them biking and see if we can elevate symptoms or make them feel better, because we know that if they're just sitting there doing nothing cognitively, they're going to their body and their mind is going to wander. I think it felt like everybody was shutting down activity, and I said we have to have them do something and have them start biking or doing something low level. The worst thing that's going to happen, they're going to have elevated symptoms because they're not doing a lot of strenuous activity, and they're just sitting there. I mean, you know what the training room looks like. They're just
Mm-hmm.
sitting there biking, doing nothing. And he's like, you know what? That's one of the things that we're doing at UPMC is that we're trying to get more athletes and more people to do low grade activity to increase the blood flow to help to heal some of the cellular injury that's going on. So,
Mm-hmm.
and that was 12 years ago. So I think working with those people and those colleagues helps out a lot. And I think if I didn't have that relationship with Mickey and I didn't have the relationship with, Dr. Meehan over at Children's Hospital Concussion and Dr. McGrath, who's a neuropsychologist in Brookline, and worked with them as closely as I did and being on some of the concussion boards that I was on in Boston, I never would have been able to care for the athletes at Western like we do now. Like I felt like we were in the forefront of doing all the
Mm-hmm.
neurocognitive testing. We went from one platform to the next, and we were kind of felt like we were in the forefront of that stuff. But that was only because I asked questions, I became involved, and then I did things to make sure that the athlete was getting better. So I think there's definitely that goes back to the education piece on how do we get better, trial and error, but also you said standing on the shoulders of giants and learning from them. So, and that's what I try to teach the students that I deal with today. And even the young clinical or the young professionals that come out, they come out now with a DPT, and I feel like they have that degree and they pass their exam and they're standing there like a deer in the headlights of like, how do I progress this patient?
Yeah.
So, um, yeah, so I think that's where kind of the mentorship program and mentorship still is important,
And
kind of moving
letting
forward.
letting people know that you've been there before. If you're 20, 30 years in the game, but like you said, first of all, I don't ask you to do anything that I wouldn't do. And B, you could say when I came out of Northeastern and I had my degree and I was ready to go, I was just as scared as you. And every
Yeah,
day there's stuff that I see that I, think about and have to ask questions about. And
yeah,
it's not like you just come out and suddenly you're a accomplished athletic trainer, physical therapist, surgeon. No, it's just the next step. And there's no peak also. There's no summit. I don't think
no,
you ever
there's
get
never is.
but it's not like Sisyphus just pushing the boulder up the hill. It's it's a good, enthusiastic, climb forever, but you keep
Yeah.
gaining knowledge, and then hopefully it's like a baton race, and then you pass that baton to someone, and hopefully
Mm-hmm.
they take it further than you. That's the ultimate goal, I think.
You look back to, kind of being there and doing that, right? Kids always ask, I don't know if you've been asked this as a surgeon yet, but what's the worst injury you've ever seen on an athletic
People ask
field?
me that. People ask me that all the time.
All the time. So I go back to, well, I said the worst one was I had an eighth grade football player, because I had to cover middle school football, as it's connected to the high school.
Yeah,
One of my joys in life is covering middle school football,
of course.
being sarcastic. But there was a play where an athlete's foot was planted, and it was the old grass field. It wasn't on turf.
Yeah.
And all of a sudden I hear this blood-curdling scream, and I have an intern from Northeastern with me. So we run out into the field. The athlete's laying on their back, foot's planted, tib-fib fracture, very close to compound. I mean, it was like millimeters. So we get everybody away, try to relax him. All of a sudden, this 6'8" guy comes out on the field. He's like, "How you doing? I'm an orthopedic surgeon." I'm like, "Okay." So I move out of the way. He's like, "How you doing, son? Are you okay?" He's like, my leg. And he said, "I'm Dr. Rubash. Nice to meet you. I'm going to take
Yeah,
care of your
that's
leg."
right.
So he goes, and he set his leg with a 1-2, not even get to 3 snap. And I was like, my intern, I think, almost passed out. The athlete was like, "Oh my God, that feels so much better."
Yeah, that's right.
And I'm like, talk about being like in the midst of it and seeing that, right?
Yeah,
If any of the other kids saw that, we probably had 3 kids pass that, I would have called, to have them transported as well. But that was my real first exposure. One, he was the chief of orthopedics for Mass General. I mean, you knew his younger son, Steve, right? Because Brad was the
Steve and
older
Brad.
one.
Yeah,
Um,
we all played together. Yeah.
Yep. So it was when Brad was an eighth grader. So it was pretty funny to see that. You look back and you talk about it. But and then you know, my dad, I ended up sending my dad to see Dr. Rubash for his hip. Like, it was just kind of these relationships that you build by chance, but also by, talking to people, which I think is important, especially in our field.
Absolutely.
So to shift gears a little bit, talking about physical therapy, you talked about how you guys have physical therapy and OT, in your building. Do you rely on that for your patients? Is there, hey, go across the hall and see so and so, or do you walk them over, or, again, being new to your location and demographic, how much do you rely on them, and how much do they rely on you? I mean, is that mutual back and forth?
It's, I would say, either besides the wrist brace or 1A, 1B, physical therapy and occupational therapy is the thing I use the most. So we rely
Okay.
on physical therapy and occupational therapy. I mean, they are priceless. And the
Yeah.
fact that they're right there in the same building, 10, 15 feet away, is perfect. So I'll walk patients over who I'm concerned about, maybe a post-op patient or a pre-op patient who I'm expecting a long, protracted physical therapy, occupational therapy course post-op, and I will have them meet with the therapist just to talk, and I'll say, this patient is doing this. This is what I'd like to do afterwards. Last week I had I did a case on a chronic hand deformity after a trauma. And then I met with the occupational therapist who's actually seeing him tomorrow, and we went step by step through the plan. I'll have the therapist text me or flag me on the electronic medical system, or just walk over and talk to me. So we rely on them and they rely on us. There's constant communication. They'll say,
That's
"Hey, I
good.
want to talk to you about a couple of patients." I mean, I can't see it being done any other way. And I encourage the majority of our patients, and especially my postoperative patients or complicated patients, to stay within our physical therapy, Ortho Arizona physical therapy locations. Not only because I think our therapists are great, but the communication is so much easier. So
Mm-hmm.
if someone has a problem, if you're going to an outside therapy location, the communication just breaks down. And sometimes you'll
Okay.
have patients come back and say, "Oh, my therapist thought this and we did this. And I'll say, well, that's kind of the opposite of what we want to do. But within our system, and we're very lucky, there's constant communication. So, and that just completely benefits the patient. I mean, the postoperative course is much smoother, and I think the outcome is much better.
Yeah, that's good. I mean, we talk a lot about outcomes, and that's what drives a lot of our care. If I'm looking physical therapy based, even athletic training, where we want great outcomes for the patient and whoever we're dealing with. But it's interesting you talk about communication, because that's one of the things that we try to do and be the best at. And knowing from, so, ATI Physical Therapy is obviously a national brand, right? So sports and PT, we were acquired in 2015 by ATI. Um, we have 40 locations in Mass, plus or minus one or two. But we're in Arizona. I think there's 3 of them around you, where you are down in Arizona. And we talk about how do we better communicate with our physicians, because I know a lot of the docs I talk to, just from my experience, they say, I don't want to hear from you unless something's going terribly wrong, or you're sending them back to see me if they're coming in and you think they're going to be able to return to activity or to their job or whatever it may be. And even then, sometimes we'll write a note, or the way our system works, it automatically will send a progress note, an evaluation, a discharge note to the doctor once we complete it, so they'll get it. So how we kind of bridge that gap with communication is, one, the therapist should be reaching out, and that's one of the challenges that we have seen with younger therapists. They don't like talking to doctors, and I don't know what it is. They think that you guys are like some aliens from Mars and they can't communicate with you.
Yeah.
And it's very peculiar, because I mean, you like to go out and drink beers. I like to go drink beers. Why not go get
True.
together and talk about, hey, how's things going in clinic? What are you seeing? What are some of the things you're seeing from the patients we're sending you, or vice versa? Because I think that relationship is one of the strongest bonds you can have, is with a physician if you're a therapist or an athletic trainer, because you say you share the same interests, but you also are sharing the same bond with that patient. So why not communicate that with them about them? So, and you'll learn a lot from each other, because one thing the doctor doesn't want to do is sit there and talk about physical therapy protocols with you. They want to tell you, hey, how the surgery went, and then you're the professional that should understand the protocol to progress that patient. And if you don't, you need to look at the best practices that your company then has, or what the doctor has, and then look through how to progress that patient. So the one thing that I struggle with is that I give opportunity to all of staff, and I think most people do, but I feel like they just, one, they don't think they have the time, or they don't have the time given their daily schedule. But there should be the ability to be able to send a quick 1-sentence email to your doctor. Hey, Jim Smith came in today. Knee was swollen. This is 10 days post-op. Felt warm, hot. I want to send him in. Do you have time to see him today? Plain and simple,
Yeah.
right?
Mm-hmm.
But there isn't that. I don't know what it is. I don't know if we just grew up learning differently, or maybe they're not teaching it in school the way that we would like them to do it. But I feel like the mentoring piece would help. So it's interesting, because the only reason I went on this little tangent here, communication, because you mentioned, hey, I can walk across the hall and talk to that therapist, and I know that they can come across the hall and talk to me. So what's stopping that person down the street from picking up the phone or emailing you, or coming to the clinic and saying, hey, Dr. Roth, I'm Jim Smith. I'm the therapist on the street. I want to introduce myself. Thank you. You referred 10 patients to me in the last month and a half. Just want you to see who I am and what we're about. And we have, just speaking, I guess, centrically about our company, um, is that I know that we have practice partners that go out and they go and try to build the relationships, but I feel like the therapist should be doing that. I mean, that's my personal thought. And I think that would increase your visibility and your ability to feel better about who's around you if you guys get clogged up in therapy, if that makes sense. Because I know that talking to Dr. Gill, or, Dr. Hayworth at Children's, or, over at MGH talking to, Dr. Asness or that group, and they have therapy right there. But a lot of times people are waiting 3-4 weeks to get into therapy. So they're looking for other avenues to send people to. So I know that happens. And, I just wonder if there's just been bad. I mean, have you guys heard, like, let me back up. I think the big thing is probably experience that you've seen in the last 5 months with people outside of your clinic that have come in and been bad recoveries, right? Or people in the group that have said, hey, you know what, don't go over there. They don't do anything well. Like everybody we get back after a rotator cuff repair then has a frozen shoulder, because they're
Yeah.
not moving them, you know. So it'd be interesting to hear what you think, as far as, or maybe it's just you haven't had that experience yet.
No,
I can
luckily,
hear a
luckily,
very
I
fast,
yeah.
what's driving by? You got like a motorcycles and
So I
Honda
live on
Accords. What is it? Honda
I,
Civics?
I live in Scottsdale,
Oh yeah.
on North Scottsdale Road, and Scottsdale is an interesting place because there's a lot of there's a lot of new money here, and there's a lot of
Yeah.
people who like to show off, and so
Okay.
showing off in Scottsdale is driving 110 miles an hour down the road,
Well, you might
and
get some.
revving your engine.
You might get some upper extremity reattachments then.
Yeah, I was unfortunately, I see some people, zooming in between traffic on the highway on their motorcycles, and
That's stupid.
like, I'll probably see you later. Unfortunately, I mean, it's
Yeah.
unfortunate. Yes, it's stupid, but
At least you won't
it
get
is.
any snowblower traumas in
I
Arizona.
know we had a bunch in the winter and in fellowship, but that people find ways to. There's a lot of fireworks out here,
Yeah.
because it's nice all the time. So
Yeah.
people are so crazy in a good way.
Yeah. Sorry to get you off track with the zooming cars going by, but
No, it's fine.
the question was I think a long kind of I went on a tangent again about communication with
Yeah, so
therapists and
I
doctors,
would
and
say
it drives me
luckily,
crazy. It drives me
yeah.
nuts.
No, luckily I haven't had the experience of where a patient comes in and says, "I went to X therapy place. I went to Rizza's therapy, and now I have a
It
frozen
sucked.
shoulder." It
Yeah.
sucked. No, I would say, and because we're in such a big group, and then we have so many therapy locations, I think the vast majority of patients that I see are already plugged into our therapy. And I haven't been here long enough
Yep.
to know of the outside therapy institutions, whether they're good or not. I know one of my friends who's the same year as me, who does the same thing as me, but works for a different ortho group. They don't have therapy, so he's found
Hmm.
a couple really strong therapists that he was talking about. So I know there's plenty of strong therapy locations and therapists outside of Ortho Arizona.
Yep.
We're just lucky to have great therapists within our organization, and communication is key. And we talked about it. You give patients your cell phone number, I give patients my email address. We'll get you in same day, next day. Just because going to urgent care, going to your primary care, getting a referral, waiting 2 or 3 weeks is just not appropriate patient care, especially for some of the things that I see, and that you see. And people need to get back on the field, in your profession, and people need to get back to work or back on the field in my profession.
Yep.
And a lot of this is not only physical but mental. So there's an incredible amount of anxiety and anguish that comes with an injury. Whether you're a kid and you have a gymnastics competition or basketball tryouts, or you're an adult and you're the sole provider for your family, or you're, a snowbird here in Arizona and you've come here for 4 months from Canada and you just want to play golf with your family, and now you can't. I mean, a lot of this stuff is life changing, hopefully temporarily, but it's life changing. So not only are you dealing with the X-ray, the MRI, the physical exam, but these are real people who have real
Yeah.
issues,
No.
and getting them in to see a professional, to see you or to see me or any of our partners, is a big part of the battle.
Yeah. Yeah. 100%. I think that quick access is what we always talk about, and how can you do that? Because that can change a person's life, because you don't know what their situation is outside of when you see them for that consult or that surgical procedure. They could be the sole provider for their family. And it also could be that that kid is now relying on you fixing them and then going through rehab so they can get that scholarship to go to college. Right. So
Absolutely.
there's that balancing act. Right. So I think that's important. Orthopedics, athletic training, physical therapy, are all like check the box things that we have to make sure that we're giving that quick access to the people that we're dealing with.
Yeah. Couldn't
So
agree
to kind
more.
of close out here, what advice would you have for that young student that is looking to maybe go into medicine? Given your path and what you've experienced, what would your words of advice be to them as they're looking to maybe take that journey?
Find a mentor. So, you know, do whatever you can to find anybody who is a physician. It doesn't even have to be an orthopedic surgeon, or it doesn't have to be, if one of your friend's parents is a doctor, or your primary care doctor, or your pediatrician, or find a mentor, introduce yourself, and ask, "Hey, can I hang out with you for a day or for a week, or can I watch surgery or come to the clinic and meet the patients and see what it's like?" Because it's all about exposure. And as soon as you do that, then you start to learn, am I actually interested in this? And that's a very superficial level. But once you meet one person, they'll introduce you to somebody else. And they'll introduce you to the residents or the fellows or the medical students. And that is just the biggest stepping stone you can do is find a mentor, find someone to show you what it's like and to open that door for you. It doesn't have to be a famous doctor. It doesn't have to be exactly what you want to be. Can just be your local family medicine doctor who's been taking care of your family for 30 years. But find a mentor. I have a lot of patients who, not a lot of patients, but I have some patients who will say, "Oh, my son or daughter is in high school or college, thinking about going to medical school, or they're a first year or second year medical student." I give them my email address. I say, if they ever want to come shadow me in the clinic, come to the OR, if they're a medical student, they can scrub into the OR. I say, don't hesitate to reach out. I don't care if you want to go into internal medicine, OBGYN, psych, or you really want to be an orthopedic surgeon. Just the opportunity to bounce ideas off somebody who's been through it before and just to see things is, I think, incredibly important. So, hopefully, Riz, you're able to give my email address out. We can do it now or at the end. But, I would encourage anyone who listens to this, whether you're an aspiring, physical therapy, occupational therapy, athletic therapy student, future physician, future NP, nurse, PA, just email me. And I've been lucky enough that I know a lot of people, and we want everyone to be in that position. So everyone needs to know a lot of people, because if we keep spreading our network, it improves communication, it improves mentorship, it improves learning. And at the end of the day, it improves patient care and patient access. And that's the whole goal of this. So I'm happy to talk to anybody at any time about anything about this journey, because I was very lucky. It was still very difficult, but I was incredibly, incredibly lucky to have the people around me. And some people aren't that lucky, and some people don't have that sort of access. But we can give people that access. So finding a mentor, that's what I would say.
I think that's a great way to end the episode today. I think we talked about a lot. There's probably a lot of noise in there that we'll have to go through and edit in the post.
Sure.
the post episode edits. But I think, I truly appreciate you taking the time. I know you're busy. You got a big case tomorrow. You had mentioned that you had emailed a few mentors about back
right
here in Boston. Listen, I do appreciate it. Hopefully when I'm out in Arizona next month, we can get together and maybe
of course.
We can do like a quick, maybe 15, 20-minute follow-up on the episode. It'll be great.
I would love that. Yeah, that'd be great. We could do it in person.
Yeah, I'll bring my gear with me. My wife will be pissed off that I'm carrying extra stuff. Thank you for tuning in to Behind the Sports Medicine Podcast. This is your creator and host, Andrew Rizza. If you enjoyed the content from today's episode, give us a like, leave a comment, and share on social media. You can find us on Apple, Spotify, and wherever you listen to your podcasts. You can also follow us on Instagram at Behind Sports Med Podcast, on X under AJR Sports Sci, or check us out on our websites at ajrsportscience.podbean.com and at ajrsportscience.com. Stay tuned for our next episode.